Have you ever wanted to get functional medicine care, but cost kept you from being able to afford it? Or have you ever been paying for functional medicine out of pocket and you wonder why you're paying for health insurance if it doesn't even cover what you need to heal? If you are in either of these categories, then you don't want to miss today's episode. On today's episode, I'm interviewing Danielle Drori about a new health insurance alternative, New Health. New Health is a cost sharing or health sharing program that enables their members to get coverage for medical expenses similar to how we experience coverage with health insurance, but it covers way more for way less. I found out about New Health in the last 2 years, and while I haven't been able to join myself, I am in a cost sharing program, and I can tell you that New Health is the top cost sharing program I would recommend to anyone. And on today's episode, I'm going to show you why. By the end of today's episode, you're going to understand how a cost sharing program works, what types of things you can share in it. It's a lot, hint. What types of things can't be shared, all the ways New Health is superior to other cost sharing programs I've researched, how much a monthly membership costs, and tips on how you can transition away from your current health insurance or cost sharing program and get into New Health. If you've ever wanted an alternative to health insurance but didn't know where to look, I hope today's episode excites you and gives you hope for a better relationship with your finances and your health. Hey friend, welcome to the Better Belly podcast. If you're currently trying endless supplements, doctor visits, and diet changes to heal your mystery symptoms, you are in the right place. We're here to solve the real root causes behind your gut, hormone, skin, sleep, and brain concerns, literally anything and everything in your body. My name is Allison Jordan. I'm a functional medicine practitioner that has supported over 150 clients just like you to heal problems that no one has been able to fix. You don't need a perfect diet or a random supplement you found on Instagram to heal. You need a proven system that heals your whole body from the inside out. That's what I'm here to share with you, episode by episode. It's time to make health easy again. And just as a reminder, this information is not meant to diagnose, manage, or treat disease. Always consult with your own health practitioner before you make any changes to your health. Awesome, guys. So I'm so excited today to introduce you to Danielle Drori. Danielle, thank you so much for coming onto the Better Belly podcast.
Thank you for having me. I'm very excited to be here.
Awesome. So Danielle, I would love to just jump in and have you start telling us. Our listeners have gotten a little bit of their palate, just little taste buds of this idea
Uh-huh.
of new health, cost sharing programs, something that's different. It's like an alternative
Yeah.
to insurance that might actually do what insurance is intended to do, maybe. But so I would love for you to just start the conversation for us. How would you describe New Health? And tell us just a little bit about its background.
Yeah, absolutely. So we are an alternative to health insurance. So we are what you call a health share. The idea of health sharing began, I want to say, maybe like 40 plus years ago. And the whole idea is really where people contribute a monthly amount, which goes into a community fund, so that when someone from the community has a medical need, it's paid for through the fund. It was really popular when it first started in a lot of Christian communities. So most health shares have their members take an oath of Christianity. We are different. We are inclusive. So we don't have any sort of religious affiliation. We were actually started by a man named Joshua Rosenthal, and he started the Institute for Integrative Nutrition. So it's called IIN for short. IIN is actually the world's largest nutrition school. They teach holistic nutrition. They teach people how to become health coaches. They have over 155,000 graduates in over 175 countries. And he always spoke in the curriculum about how broken our healthcare system is and how it really works more like sick care than healthcare. And after he sold IIN, his next mission was to really change things in the healthcare industry. And this is really where New Health was born. So we do a lot with prioritizing wellness, healthcare, helping people stay healthy. So we're not just here for emergencies, we're really here for your everyday health as well.
And I mean, that's actually not even 100% true of other health shares. I'll just start sharing other differences because I'm going to link an episode in this podcast, which is my just personal analysis of traditional insurance, another cost sharing program called
Mhm.
Samaritan Ministries, and New Health. And I went through this whole thing where my husband transitioned to a job we knew we wanted him to have,
Yeah.
but it didn't come with insurance. And I
Yep.
already knew I didn't love traditional insurance. So I was like, I'm willing to do like the research and figuring out how to get onto the marketplace, but I hated the price for marketplace
Yeah.
insurance. I didn't even love traditional insurance to begin with. And I just dove deep. And when I found New Health, which was unfortunately several months after we decided on what program to be in, and I was already pregnant at that time,
Yeah.
so not the right time to change. But I loved that when I found New Health, I'm like, oh my gosh, you guys, you cover preventative care, which I
Mhm.
don't, if I am correct, I believe that no other cost sharing program, at least no other cost sharing program that I know of, covers preventative medicine, just your like annual physician visit or your baby wellness
It's
visits.
a crazy concept, right? So, yes, preventative care is something we share in. So we want to use the right terminology. So when we talk about something that, when you say insurance covers it, when you talk about a health share, we want to talk about how we share in it. So
Yes.
those are the terms that we're going to talk about. So when you hear me say the word share, that's very similar to what an insurance company would use as the word cover. But you are totally correct. I would say 95% of health shares do not share in preventative health, or they are very limited with what they share in. It might be just one annual physical, and it might only share, they might only share a very small amount of money for it. Some of them don't share in preventative health until you've been with them for a certain amount of time, or you've paid them a certain amount of money, or you've paid their version of a deductible or an initial unshareable amount. Whereas for us, preventative care starts on day one. As soon as your membership begins, you can start, taking advantage of all the preventative health allowances that we give people.
Awesome. So let's keep that conversation going. What else can people share in? So we got preventative care,
Yeah,
which is a
so
huge thing people think about.
when we talk about preventative care, starting on day one of the membership, everyone receives allowances for different preventative health services. So everyone gets an allowance to do their annual physical or wellness check. Now, a really big thing about New Health is that we do not have network restrictions. So our members can see any doctor anywhere, whether they're alternative or traditional. So if you want to see a licensed naturopath or a functional medicine doctor, you totally can. We also give a allowance for a well woman exam and a pap smear. We do another one for a mammogram or a thermogram, which is pretty cool. We do another one for a colonoscopy. We also have allowances for STD testing and birth control. So, for example, for an annual wellness check, it's a $250 allowance. And basically, our members just tell the doctor that they're self pay. They get their itemized receipt, they submit it to us, and then we reimburse them up to $250. Again, a lot of other health shares, if they do give you an allowance for a wellness check, from what I've seen, it's usually around $100. But we actually do extensive research every year as to what these services cost for self pay patients.
Yeah.
And the amounts that we've set forth are actually a little higher than what the national average is. So we really don't want our members to have to come out of pocket. So usually, I mean, I know for me, I just took my daughter for her wellness check, for her 2-year-old wellness check, and it was $125. So I got reimbursed that 125. For babies, we follow the standard schedule. So I know they're in and out of the pediatrician's office every couple of months. So we reimburse up to 250 for each of those, plus immunizations on top of that. So, I mean, it really, for everything you need for preventative, it's right there. Blood work. Blood work is something very unique to us. So, I'm sure some of your listeners may know this, but blood work tends to be an area that doctors like to upcharge roughly
Mm.
95%. So we actually have our members order their own blood work through a company called Evexia. And then Evexia will send our members over to their local lab core to have their blood drawn at the lab. We give them some panels for free. So, like your insulin, your CBC, your metabolic panel, which are like the ones that your doctor typically wants to run at your physical, you can actually order those through Avexia for free as many times as you want throughout the year. And then everything else that they order, we reimburse them up to $80 a year, but it's all wholesale price. So, there's labs in there for like $4, $8. I think a thyroid is $15. So the 80 ends up going a really long way. So that's definitely something unique to us as well.
And I really want to emphasize that as someone who is a health practitioner, orders labs for clients on the regular, and I see like the amount of shielding that is created between like the customer just doesn't know what the price of the doctor appointment, let alone the lab, actually
Yep.
is. Like we have a sense of maybe for a lot of consumer products what a laptop might be wholesale price
Right.
or right, but or even a couch or something. But it's really like they work their butts off to make you as ignorant as possible.
Hmm.
And I get my clients for the work that we do in my program, the Better Belly Blueprint, near wholesale pricing. And people are always, I actually, the most common question I get is this the same lab as on this website? Because it's $100 to $300
Yeah.
cheaper.
Yeah.
And so you're describing the same issue with blood work and other labs. And Avexia is very new. At least I learned about it several years ago. And I mean, when learned you guys were doing that for your members, getting them access, teaching them about it, it's like mind blowing. It's just very empowering.
Yeah, when we first started with the blood work allowance, we did a survey and asked our members what were the most common labs that they ordered throughout the year. And we priced those out at various labs, and they came out to be anywhere from 800 to about, I think it was around $1,600. And through Avexia, it was $80. So that's where the 80 came
And that's
from.
where the 80 came from. All
Um,
right.
so the 80 is going to go a really long way for
That's
people.
it's just
Um,
amazing.
yeah, yeah.
All right.
And then the last part of preventative health I definitely want to touch upon is our self-care allowance. This is like everyone's favorite. So it's $200 a year that we give to each family to use for things like the chiropractor, a massage, gym membership, vitamins, supplements, homeopathy. Or if you do run a lot of blood work, you can use part of your self-care allowance to get reimbursed for the additional blood work. But it's meant to be really flexible and just support your everyday health, and just give you that little boost that you need to get reimbursed for things that a lot of other, health shares don't share in, and a lot of health insurance wouldn't pay for either.
I was gonna
So,
say these are a lot of the things that maybe HSA and FSAs don't cover supplements, right?
mhm.
So even if you have that really cool HSA FSA thing, you're going to be paying out of pocket for supplements or again, many insurances aren't going to cover a lot of these things or they don't cover it easily. You have to
Yep,
like go through all these hoops and you might not be able to complete all of the hoops to get the chiropractor sort of covered. And
exactly.
then lastly, health shares. Again, you're the only ones that I'm familiar with that have a self-care allowance like this, which again, I mean, it really shows that your founder, like he was really like was
Yeah,
trying to change some things. He was really trying to
really.
get into preventative care in a totally different way.
Yeah, exactly. I mean, I love my self-care allowance. I use it for different things every year. People are able to just utilize it for so many things that, support them in their daily lifestyle. Like I know what you're saying with supplements. I tried when I had health insurance, I tried submitting like my prenatal vitamins for my FSA and they denied me.
Oh yeah. Oh
Like,
yeah.
like, come on. But yeah, and reimbursement is also really quick. So that's something very unique to us. With all the preventative allowances, you can submit them in for reimbursement and you can expect a check in 1 to 2 weeks, or you can set up direct deposit. And honestly, I've seen that in my account in just a couple of days. So that's also something very unique to us.
Yeah, I'm on a different cost sharing program again, not to sound sometimes I feel like I'm like a hypocrite, but just because we were on a different one and I got pregnant, so it's just not the right time to change. But it takes there's about a 2 month lag from
Wow.
the month you get in the month that you have to pay for the thing. Then
Yep.
if you submit it in that month, with usually you need like 1 to 2 weeks in advance of the month ending. If it gets approved by the end of that month, then you have to wait you have to wait that next month and then it shows up. Then you get it
Wow.
shared for the month after.
Wow. Yeah. I mean, we give, so as an example, like a colonoscopy, it's a $2,500 allowance. I can't imagine paying for that and having
Out of
to,
pocket and having to wait.
yeah, that's like, that's groceries for my family for a very long time. Like, I can't wait that long for that.
Right.
Um,
And our families has built in that buffer, like our own like health savings account that like gets essentially depleted and then refilled as
really,
reimbursements come in. But it'd be nice many people might not be able to manage that, or it takes some time to build up that structure. So again, it is really nice to have that immediacy and it feels a little bit more modern,
yeah,
like,
for
okay,
sure. Yeah,
immediate.
absolutely. Absolutely.
I also want to just make a note to like the no network restrictions. Like, I think maybe that's like you made such a clear or like quick blip into that. But for our listeners, I know that a lot of times when we're considering something different than traditional insurance, one of the biggest things that holds people back is it's just different.
Yeah.
And there's all these
Yeah.
terminology you're like not allowed to say cover, and then you have to say share. And it can seem like, is this a real thing? Can I trust it? But it literally the things that cost sharing programs are trying to do are how everybody wishes traditional insurance worked. You're
Yeah.
like, can't I just go to who is like an actually good doctor and just go there and know that I can get that covered? And so the freedom that even I experienced in my cost sharing program of being able to just find someone who's good. And I don't have to be like, and are you covered by this insurance?
Yeah.
Like,
Yeah. And then also, how many times do people go when they have insurance? They go on their websites to check if their doctor's in network. It's on the website. They go to the doctor and then they get a bill to find out that the website was outdated and they're actually out of network. Because I know that happened to me when I had insurance, and I've heard that I'm not the only person that's happened to. So, even with health insurance, some of the things are so backwards, having to worry about, am I going to get a bill?
a
Did I hit
surprise
my
bill. Yeah.
deductible? Like what's going on there? Like I remember I went to urgent care and I ended up getting a $250 bill and I called and they forgot to process my insurance. But how many people would just pay that without, thinking about it? So,
And you
yeah,
don't get that. You just know it's almost like I'm buying a computer. I'm buying something at face value. And actually, many times what they'll look at you, they'll be like, "Oh, you're cash pay," and they're like, "Actually, it's $25 cheaper," like,
exactly,
right? But you get
exactly.
it cash value. You start to actually know what people are really charging for these things,
It's
which
true
is
price transparency.
oh, which is often way lower than what the insurance bill is going to be like. And there's reasons for that. I'll link an episode of my podcast where I interviewed my dad, who's a surgeon, on why insurance prices are so much more inflated. So if anybody wants that like kind of technical information.
Yeah. I mean, that's, I think, what people are worried about, right? They're worried about what if I have, what if I need surgery and it's millions of dollars? Well, people really have to remember that if you ever saw your medical bills and you saw the numbers on there when you have insurance and what it would have cost, when it went through, it's always higher when you have health insurance than when you're self-pay, just as what we were just talking about. So those $1 million surgeries that you're thinking of are actually far, far less when you're self-pay. So just as an example, I spoke about how I brought my daughter in for her wellness check. When I got my itemized receipt, it started at $500. So if they would have submitted this to insurance, they would have submitted it for $500. And then after the self-pay discount, it came down to, I think it was the 125 or 150. So the difference is really crazy with what it is.
Why don't you walk us through? And there's like so many things you guys actually provide on your website, a lot of information on exactly what you cover and when you join the program, exactly how much, like what is the number, you're going to get covered.
Sure.
So I'm going to provide a link for people to go to your website and really just data mine because it's more than we're going to really realistically cover on here. But can you actually walk us through what is it like? Like you guys have a couple different tiers of program or like
Yeah.
tiers of ways that
Mhm.
people can work with you, which is pretty similar again to insurance. You have like, silver, gold, platinum, or depending, like how do you guys function? If someone
Yeah,
wants an
so
option, what are the options?
So there's three options. Okay. So when someone enrolls, they're going to choose what we call is the initial unshareable amount. We call it an IUA. Essentially, what this is when you have a new medical event, like a new illness, a new injury, or a pregnancy, you would be responsible to pay your IUA, and whatever is left remaining is what New Health would share in. So there's three options. There's the 5,000 IUA, the 2,500, and 1,000. The lower the IUA, the higher the monthly membership fee, but you won't be responsible for more than three IUAs per family per membership year. So if your family has a really bad year and there's a fourth illness or injury, you don't have to worry about paying for a fourth IUA. We would actually share in the whole bill. So three things could happen to you. And then if one thing happens to your husband, you don't have to worry about paying the IUA because you've already paid three. So what this is going to look like, for example, let's say you woke up with appendicitis and you need emergency surgery. Let's call it a $40,000 bill. You would submit that to us unpaid. Our team will go through your bill to make sure it's correct. And in our research, we have found that 83% of medical bills actually have an error on them. So our team finds those errors. Plus, we also negotiate the bills down. And on average, we lower bills by about 46%. So let's say we dropped this bill to $20,000. If you have the $1,000 IUA, you're now going to pay the hospital $1,000, and then we're going to send you a check for the remaining 19,000 so that you can pay the rest of that bill.
Because who has $20,000 to
Right.
wait to around to be reimbursed?
Right, exactly. Which unfortunately, as we spoke about, other health shares do have people wait around, but we've actually never had anyone go into collections. We've paid out on 100% of the eligible needs that have come through to us. So we're doing an excellent job here at Sharing, and like I said, it's just that easy. There's a portal that you submit everything through, and we handle the negotiating. You don't have to worry about that. So it's another step that you don't really have to stress about.
Yes, yes. And something for people to know, there's two additional components, and I think you guys break it down beautifully. Like, so if anyone's a visual learner, but there's two additional components. So, like, you pick your initial unshareable amount, which is it okay if I just say, which is most similar to your deductible?
Yeah, I mean, you can think of it, it's almost like a mixture of a copay and a deductible, if you want to think of it that way, because it's what you pay for each new
Event.
medical event that
Yes.
occurs. So
Opposed
we
to an
would,
annual, right?
right, right. We don't tally everything for all of your events. It's per medical event. But let's say it was like you fell a week later, you got an MRI, and it turns out you tore your meniscus and you need surgery and then you need physical therapy. We would total all of those bills together because it's all related to the one injury, and you would only pay your IUA, and then we would share in everything beyond that.
Yes. So then what people are paying for monthly rates
Mhm.
is not to like steal the wind out of your sails, but maybe maybe I just want to share it and you can tell me if I say it bad, but it's dependent on how many people are in your household. So is it a
Correct.
one person household, two person household, or family? And once you get to family, it's unlimited, right? It's kind of like you got
Hmm.
your
Yeah,
family, and it doesn't matter if you have one kid or two kids or three
correct.
kids.
The price is the same. Yeah. So we do four different types of memberships. You can be an individual, so one person. You can be a couple, two adults. You could be an individual with children, so just one parent, or a family is two parents and children. This is also something unique to us as well. Not many health shares actually offer an individual with children plan. A lot of
Mm,
them only offer a family or an individual or a couple. And with the religious health shares, if they do offer the individual with children, a lot of them actually won't share in pregnancy because they consider it to be out of wedlock because there's only one parent that's on the health share, which is crazy to me. But, there's so many situations where maybe the husband gets free insurance and they didn't need to be on the health share. You don't know what that person's situation is. But because we don't have that religious affiliation, our members don't have to worry about that. And we would still share in pregnancy, even if it's one parent with children or
yeah.
an individual.
Yes. So you have those tiers that matches it. So if you're like, just a single individual, you're not going to have to pay as much as a family, like on your monthly payment. And then the next determining factor is the age of the person holding the account or something like that. It's
The oldest person in the family.
oldest person in the family.
So,
Okay.
right. So it's an age bracket. And so the older the age bracket, the higher the monthly membership fee is going to be. And it's available from ages of 18 through 64. So the membership would end once someone turns 65.
Yeah. And I'm going to put a link to that kind of membership chart. You guys break it down so easy. You can just go on, you're the age of the oldest person in your family, you know how many people are in your family, or if you're an individual, if you're married, you know that thing. And then you could just look at each category for your initial and shareable amount and just be like, okay, what would I be paying monthly? And
Yeah, we have a pretty simple cost calculator on our website where you just put in your information and your age and how many people, and it'll show you right away what your price is going to be. So it's
okay,
a great tool.
okay, I'll have to get that from you so we
Yeah,
can just easy link. Simple
exactly.
cost calculator. Okay. So now people have an idea of what it's like, how epic it is to just only know that, let's say you're on the 1,000 initial unshareable amount and you have three events and you're like, I just need $3,000 that I can have saved somewhere for a year and like nothing can hurt me. Or at least like to a certain extent, you're going to be really, really, really covered. Um, which honestly, so many people are paying more than $3,000 for all the
Oh
hidden
my
bills
God,
and
yeah.
fees after traditional insurance.
We hear
Oh,
people that have like $20,000 deductibles, like $15,000 deductibles, and they're paying thousands of dollars. It's like
yes.
insane.
But
It's
you don't even see that money often if it's through your employer because you don't see it on your you see your taxes get taken out on your W-2 or like your paycheck, but you don't see how much they're pulling your for to cover insurance. You have
yeah,
to actually ask. And when I did that for my husband from his employer we were leaving because I was trying to get a feel for like what's comparable, how much more expensive is it going to be in the marketplace or do a cost sharing program. We save hundreds of dollars a month
mhm.
doing a cost sharing program.
Yeah, and what I think what people also don't realize is that when you have employer insurance, and let's say when open enrollment time comes around, if the company decides to tell you, oh, we're doing something really great, we're not really going to raise the cost that much this year. Well, guess what? The company is still getting charged more. So you know where that's coming from now is your potential raise that you're not going to get because the company has to make up for it somehow. So instead of them charging you more for your health insurance, they're most likely going to be decreasing any sort of bonus or raise that you'd be getting that year. And I think that's what a lot of people don't realize is that the money has to come from somewhere. And if a
But if
lot
we
of
don't see it, then it feels
right.
like a sweet deal.
Exactly, exactly. So when people do opt out of their employer insurance and go to a health share, you're not only saving money for yourself for your health care, but you're potentially giving yourself a raise at work too, because you're saving the company money there and they have that money allocated now to give you a raise, hopefully, as if more employees opt out as well. But that's just something people I don't realize about the back end of things.
Yes, 100%. And I will say, I don't want to discourage anyone. I just like giving information. That's the whole point of this
Totally.
episode. But I've had heard of sad stories. I don't know if you know more about this, where for whatever reason, the policy of the company is that they don't give you the money they would have been paying to the insurance company if you opt out. I've heard of that
Yep.
happening in one case of a client of mine who was looking at it, and I just like my heart was grieving for her. I was like, you have no options? That's
Yeah.
your money.
Yeah. Yeah, we hear it a lot from people.
Okay.
Yeah, it's pretty crazy what some companies do, or some companies are now choosing to not insure dependents and they'll
Okay.
only insure the employee and they don't give any options at all for spouses or children because it's costing them way more money and the company just can't afford it.
So
So that's
expensive.
something too.
And we are theoretically the consumer. We're theoretically the person they should be serving, but we have no connection to what we're paying and what we're receiving. And that's one of the reasons I think the healthcare system's so broken is that, if you were getting horrible laptop service and laptop care and the laptop sucked, people would stop buying it and the company would go out of business. So laptop companies are motivated to give you at least reasonable products for the price they're asking.
Uh-huh.
And that's not quite happening with healthcare. My episode with my dad covers a lot of that more in depth if people again just want to like know. But let's
Yeah.
talk about I want to talk about two big things here. They're sort of different, but I want to make sure we cover them.
Yeah.
One is pregnancy and maternity.
Yes.
Traditionally, I mean, it's a really big life change. I'm currently pregnant. I'm due soon. My first pregnancy was on traditional insurance. My second pregnancy, this one, is now on a cost sharing program. I hands down think that already just the amount that's covered, what's covered, it's how easily it is to be covered is just hands down better. Tell us about what it's like to be pregnant and get maternal care at New
Yeah,
Health.
absolutely. I love what we offer for maternity. I wish that I had my pregnancies with New Health. Basically, when you get pregnant, your responsibility is only your IUA. So whichever IUA you chose when you enrolled is the amount that you're going to pay for your entire pregnancy, your delivery, any complications that arise. You can choose to have a home birth with a licensed midwife, or if you need an emergency C-section, we would share in that as well. But we share in everything from your prenatal visits, your ultrasounds, your blood work, your birth, your postnatal visit. We also just started sharing in pelvic floor therapy, chiropractic care, and postpartum depression therapy.
Nice.
Yeah, and again, it's all just one IUA. We do have a waiting period, so this is why I know you couldn't join us sooner, Allison.
It's
But
common. That's fine.
yeah, I think all health shares have some sort of waiting period. Basically, for us, the estimated due date would have to be in the second year of membership. So it doesn't mean that you have to wait until year two to become pregnant. It just means that the due date has to be in year two. So essentially, members just have to wait, I would say, 3.5 to 4 months to
Yeah.
conceive from when
Yeah.
the membership starts, and then it would be shareable. And we do a really great welcome call when you find out you're pregnant. We really encourage you just call us, email us, and we're going to walk you through the whole process as to what to tell your providers as a self-pay patient, what to submit to us, when to submit it. We help you with all of that because we know it's, you know, a little I don't want to say scary, but it's just new for people, right? Like not everyone knows what they're doing when they join a health share and then they become pregnant and everything that goes along with that. So we're going to hold your hand and walk you through everything.
Yes, and I'd say I've called you guys before and talked to you about different things as we were like, okay, we think we want to switch to New Health, but when can we do it? And your guys' customer service has been so great. Like you're quick to responding. I think you guys have left me voicemails, be like, hey, we got your message. You're like, insurance doesn't do that. Sometimes you're like, did they even get my message? I don't know what's going on.
Yeah, so you'll never reach a call center. You'll most likely speak to the same person about your submitted need. Customer service is super important to us because, again, the process of healthcare and submitting things could be, it's like an anxious feeling for so many people, and we want them to feel supported through all of this. So you can call us, you can text us, you can chat, you can email, and I do encourage people to take a look at our Trustpilot reviews. We have almost a perfect 5-star review. I think it's like a 4.7, 4.8 right now. And you'll see everything customer service, how quick it is that we pay people. I believe we are still the highest rated health share on the Trustpilot platform, which we're very proud of. But I definitely encourage you guys to take a look at those reviews and you'll see that what Allison and I are speaking about is legit and that our community supports it for sure.
Can you guys imagine like what it's like? Because I'm assuming most people listening are on traditional insurance, or maybe you're on in a cost share program
Right.
that you're not satisfied with. But can you imagine how much less like energy and anxiety and just like time you could not waste by just knowing you could call somebody, your health insurance alternative, and just get your answer. Get your thing
Hmm.
covered. Like just be in and out. And that's how I feel right now in my own cost sharing program. Um, and again, not just to, because there are a lot of benefits, and I think in mine
Totally.
they have good customer service where I just know like there's a caring person. They'll say like, I am really sorry you're going through that. I'm sorry to hear you're sick with blah
Yeah.
blah blah. Or and I'm like, I bet New Health would do the same thing. And you're like, you're like no one even, you're like, I just want my thing covered. You if you're in traditional insurance, you're just like, just get me in and out, okay?
Yeah. Yeah, absolutely. I think for us, something that's very unique is we actually have a medical concierge team that our members can contact. So if you know you need something ahead of time, like an MRI, an X-ray, even your mammogram or your colonoscopy, you can actually contact us and we'll help you find those services at the most affordable locations near you. So again, price transparency. You probably don't know what the cost of a colonoscopy should be, right? What does the average person know about that? So you can give us a call, email us, we'll help you find that. Of course, if it's not an emergency, if it's an emergency, go ahead, get what you have to get done and then submit it. But if you actually know ahead of time that you need a surgery, you can ask your doctor and hospital for an estimate. A lot of people don't know this, but they have to provide you with an estimate. So you can get your estimate, you can submit it to us ahead of time. Our team will start negotiating at that point to lower it. If we feel like you're really not getting a fair and reasonable price, we'll even pay for you to get a second opinion to go somewhere else. So that's the level of support that we give people to help the community with keeping funds down. We just had someone submit a CAT scan of the abdomen for, I think it was $3,500, and we got it down to 250.
Oh, I want to throw up hearing that. Oh,
Isn't that crazy?
oh,
Isn't that
yes.
crazy?
Ah.
So, I mean, that's what they're doing to people. And it was with the same exact provider that we got that down with. We didn't have them go elsewhere. We got it with the same provider. And it's just insane that that's happening to people, that gouging.
I'm just, I mean, and I get to hear these stories too on my end. Like, if we go back to the blood work, I had a client who I wanted her to get blood work. This was years ago. She's like, oh, that's good. I have some blood work coming up that my doctor wanted me to do anyways. And I asked her for a couple, okay, make sure you get these couple extra markers. A lot of conventional doctors will never run these. She's like, okay, I'm going to do that. Great. And it would come back and she's so excited and we have the lab work and I'm like, it's great. The information here we got is awesome. And she's like, yeah, it was just so, she made some comment. She was like so cheerful about it. She was like, it was $1,000, but it was worth it. And I was like, I'm sorry, $1,000. And I was like, if you ever need
Wow.
blood work again, please tell me because I can get you all these same markers we just got you for 250. Like, and that was
Wow.
1,000 out of pocket. It was a
Yep.
thousand after insurance
Shit.
covered, quote unquote, covered it. Yeah, yeah, yeah.
Wow.
That was you just get shivers up your back. So guys, what she's describing is so helpful because the other thing is like none of us, even me, Allison, like as a health practitioner, my in and out day in day out job is not like how do I find the cheapest procedure that's still quality? Like that's what you
Right.
guys are doing, and it pays you guys dividends to do it because you're not having to pay out as much. Your other members aren't having to pay out as much in the sharing of
Correct.
things, and so you're just
Exactly.
getting more care for a less cost.
Yeah.
And you're helping your members do that without them having to do it themselves.
You said it exactly right. That's exactly it. We're saving the whole community money by doing it that way. It's not just saving that one person, it's saving the whole community money.
All right. So to end our conversation here, roller coaster of information. I hope people have been loving it. I would love to talk about, and or I don't know if role play is the best word, but let's talk about the idea of you're thinking. Someone's at the end of this, and they're like, "Okay, I am thinking about switching from traditional insurance to to um, to either New Health to a cost sharing
Yeah,
program." I'm curious both what the biggest reservations you guys here are and like
sure.
what you say in response to those. And then I want to tell you if you don't say one of the ones that I hear from my clients when they say, "Well, I checked out New Health or I checked out this thing, but I'm really concerned about XYZ." I could tell you those first, or do you want to just go
Yeah,
over
if
what
you
you
want to
guys
tell me
hear?
what you hear and I
Sure.
can tell you, but actually before we get to that, Allison, I just want
Yeah.
to say one more thing that we include in our
Oh,
membership,
please.
which is unlimited telehealth. So
Okay.
that's one thing we didn't touch upon, and I just want to mention it because it's something we do because we talked about preventative health. We talked about a big medical event, which is where the IUA would come in. But let's say you woke up and you just had a high fever or a rash, right? Instead of running to urgent care or the doctor, we would suggest you start with telehealth, and we will actually reimburse you for telehealth as many times as you need it. But we also let you decide on the telehealth provider. So other health shares have their own internal telehealth service. And when we started New Health and we did research, what we heard from people with those health shares was that they felt very limited by the care because it was only a few doctors that they were able to work with through the telehealth. It was a long wait, or they maybe didn't vibe with that doctor and didn't have a choice the next time. So we are all about freedom of provider. So you can use any telehealth service, or if you have a doctor that provides telehealth, you can use them and we'll reimburse them for that as well. So I always think of the membership in three parts. We have your preventative care, we have, your major medical things that go on where your IUA would come in, and then for anything acute is where the telehealth comes in.
I love
Uh,
it.
yeah.
So
And then you're
comprehensive.
also going to get 35% off of vitamins and supplements and homeopathy. We give people a Fit On membership for on-demand fitness and nutrition classes. We give 2 free health coaching sessions to everyone each year. So just a ton of tools to help keep people healthy to avoid the illnesses and injuries down the road.
And webinars, which I just led a
Oh, yes, the
webinar for you
webinars.
guys. It's
Yep.
so fun.
Yes, our monthly webinars, we do a lot of informational webinars for our members, again, to help keep you healthy and informed, which I don't know of anyone else doing that either.
I love it. And actually, can I ask you a question? Because, like, maybe someone's wondering this. And again, if you guys have questions, contact New Health. They will answer your questions. But like, I used Blueberry Pediatrics, which was a
Love
telehealth service.
Blueberry.
Would you guys have covered the cost of that for children, or is
So
it's a little different because it's like a subscription opposed to like a visit?
yeah, so I actually use my self-care allowance to get reimbursed for Blueberry because I love Blueberry. Because it's an annual subscription, we wouldn't be able to reimburse you under the telehealth, but I love using my self-care credit for it. I mean, when you pay for Blueberry, I know they sent me that at-home ear infection camera
Yeah.
and
Hmm.
2 thermometers and a pulse ox. I mean, they detected 4 ear infections on my kids last year alone. So those were 4 visits I didn't have to go into a yucky doctor's office for.
And wait and have to
Um,
take time off or,
exactly.
ugh,
Exactly. And then they
barf.
just fall in the prescription. And New Health gives resources like Single Care and Good RX and a couple of other websites where you can get coupons at the most affordable pharmacies near you. So I was able to, get prescriptions for like less than $10 when I needed them for my kids.
Yeah, and I would say that might be one reservation people or something to know that the New Health does not cover, and tell me if there's like a disclaimer to this, but doesn't cover prescriptions
Right. So we don't
or
share in
cover share.
maintenance
Sorry.
medications.
Okay.
And then we wouldn't share in a medication for an illness where you have not paid your IUA. So you want to remember, because the IUA is per medical event, if you have a medical event that's less than your IUA, that's just something you would pay for. You wouldn't submit it to us for sharing. So if you maybe went to the doctor for a sick visit and it was, instead of using telehealth, maybe you went to the doctor, it was $100, you would just pay the 100. There's nothing to submit to us. So if you had a medication related to that, because it's less than your IUA, that's something you would also pay for.
Yeah.
If
So medical event, like you have a UTI, you just need an antibiotic, and the antibiotic, I honestly don't know what it would be out of pocket, but if it's less than a
very
thousand or 5,000, whatever your
yeah,
IUA is, then you are going to pay for it. But if it's like you're getting a prescription on top of a surgery or on top of PT or something,
correct.
and it is all of it more than the IUA and it's related to a medical event, then it does get covered.
Correct. Then we would share in that medication for up to a year.
Okay.
Okay. But if you ever have a bill that is less than your IUA, if you chose maybe a 5,000 IUA, if you have a bill that's over $1,000 that's unpaid, you can actually still submit it to us for negotiation and we'll still attempt to negotiate it on your behalf.
Beautiful. So even more of that customer service there. And just to confirm, and examples on maintenance medication, that might be insulin, that might be things like
The
anxiety medications, depression medications,
thyroid medication,
thyroid.
something like that.
Okay. And that can like people can consider that. But the nice thing too is that you mentioned, GoodRx, you mentioned single care. I actually have found that just buying prescriptions through Costco, if anyone's a
Oh my
Costco
God,
member,
yes.
oh my gosh, I got actually better. I signed up for GoodRx for a little while and I got way better pricing in general at Costco for prescriptions. So it's actually possible that maybe you're not going to get your thyroid medication from CVS anymore or Walgreens, but maybe you can get it from Costco or GoodRx or something, and you're going to get honestly a reasonable price or just something that between how much money you're saving on not paying your monthly fee to traditional insurance, how much you're saving on preventative care, or how much they're covering for maternity, whatever. Many times you might not be saving immediately on that prescription, but you're saving on so many other things.
Exactly. You got it. Exactly.
So this actually draws us back into maybe the most important thing. And I really recommend anybody who is starting to think this way, just call New Health. Talk about with them. Like they are experts in their program. They will listen to your circumstance. But someone's like, oh, I'm really thinking about joining New Health, but blank. And I say one of the number one things I hear is, but the thing I want covered is an ongoing medical condition.
Hmm.
Like I know I'm already sick. That's why they're talking with me, a provider,
Right.
is because they're like, I already don't feel well. I would love to switch to this, but are they going to cover it? Tell us how that works at New Health.
So that would be something we call a pre-existing condition. So we would classify a pre-existing condition as anything from the last 2 years that you've either been diagnosed with or have symptoms of or have been treating or taking medication for, in which case, if something is needed for that condition in year one of your membership, it's not shareable. In year two, we can share up to $25,000 for it. In year three, up to $50,000 for it. And then in year four and beyond, $125,000 a year for it.
And this might sound hard to people, but also consider that, well, one thing I know that several cost sharing programs don't do this at all. It's almost like you have to be, I think mine is you have to have be in remission or essentially it be not a condition you're dealing with for like a year or two, and then it has to come back for you to be covered. This is like you could keep having it. And then
Mhm.
by year two, you're getting covered $25,000 or
Right.
up to
Up to
$25,000.
25.
And it's that, I mean, most of the conditions I've worked with, and again, it really does vary per condition, but I know a lot of conditions that could cover maybe a lot of what you would go through. Maybe
Yeah,
not everything, but it really,
right.
it kind of depends on the condition you're dealing with. Like with IBS, which is what I had, I was never paying more than $25,000.
Yeah, yeah,
Um,
exactly, exactly. And there's exceptions we make for it. So if you have high cholesterol or high blood pressure, or diabetes, as long as you have not been hospitalized for those conditions in the last year and you're able to maintain it with diet and or medication, we actually don't consider those to be pre-existing conditions.
okay.
We still wouldn't share in your medications because those are maintenance medications, but let's say you ended up in the hospital in year one for one of those conditions, we would share in it because it wouldn't be pre-existing.
And another good reason just to call New Health, guys. Don't try
Yes.
to figure this all out. Don't try to math it out. Don't just decide this isn't for me. Because
Right.
I think really what you've showed us, Danielle, is that you guys in your company has worked so hard to make it work for you eventually. Like,
Yeah.
I know I had a client who they decided to, I think it was with New Health, but with a cost sharing program, they were going to keep their insurance for a year and pay for a year with that, with
Wow.
just to
Yeah.
like get
Yeah.
that
Getting
one
past.
year in where nothing is shareable. And they knew it was going to pay out dividends in the long run. And they
Right.
were so committed to it. So that could be potentially something you could consider is just
Yeah.
being like,
Absolutely. And I want to mention also something really unique to us. We have not raised our rates in over 5 years. Every health share out there raises their rates every few months, if not every year. But because of how well we're doing with what we're sharing, how we're sharing, what we're doing with preventative care, we haven't raised our rates in over 5 years. Health insurance, I think this year went up 6% in costs. And again, if you didn't feel that in your paycheck, if you're with an employer, you might be feeling it now on the back end with that lack of a bonus. But we haven't raised our rates in over 5 years.
it's just it's just amazing. And there's really so much more. I feel like we could talk for forever, but I really want to point people to really engaging with your company, asking the questions, diving in, building relationship, because I think this could work for so many people.
Mhm.
And it's a matter of it. Sometimes, like even for me, making the plunge into cost sharing was just it's different. My parents weren't doing it. My sister wasn't doing it. My friends weren't doing it. If
That's
there was
exactly.
anything that was going to go wrong, if there's anything that people were like, "Oh, that's they're going to screw you over." Like no one could tell me because no one had tried.
Right.
And so it was just like an unfamiliarity thing. And now that I've been in it and know more people doing it and have interacted with these companies, I just really want to advocate to people to not drag your feet on this because the sooner you join, the better it is in the long run because you're going to have already joined before that event happens, that critical event. You're going to have
Right.
joined, before you get pregnant. You're going to whatever it is
Right.
and really reap the benefits. So,
Yeah, I think that's really it. It's the fear of the unknown, right? That we all have. But I do encourage everyone, when you are doing your research on health shares, go on Trustpilot, look at the reviews, see what their community is saying so you can get a feel for the community that you're joining and so you do know how long it is going to take to get reimbursed and the type of customer service that they have. Those are two big unique points to us as to how quick we are to responding to you and paying you. We never pay anyone to do those reviews. Those are all people. And I think people usually review things when they had a really bad experience. So I think it's awesome that all these people are really loving our service and, talking about it online. Because again, we're definitely different from other health shares out there.
awesome. Well, in our show notes, I'm going to be linking a couple things for people to check you guys out. We have a link to just like book a virtual call. Does that call go specifically to you, Danielle, or kind of to the onboarding
So
team?
you'll be able to choose, anyone, or you can specifically choose one with me or my teammates. So you can choose there. You can book it if you're looking at it for you or your family, or if you're considering this for a small business, you can book an appointment to talk about this for a business as well. And we do have a special savings for everyone, that listens to your podcast. So if you decide, you are just ready to enroll, we have a really great discount. It's actually going to save you 20% on your first year of your membership. And the code for that is going to be BBP20. So Better Belly Podcast 20, BBP 20. There'll be a place on checkout after you get to the last page of your enrollment where you can put in that code. But if you still have questions, you want to talk to us, totally just make an appointment and we'll either do a Zoom or a phone call, whatever you're comfortable with.
I love it, guys. So we'll put all those information in the show notes. The BBP 20, get 20% off your first year, a link to enroll, the link to book, talk to somebody, book a call, your guys' website. So thank you again so much, Danielle, for coming and sharing all this super valuable
Yeah, this
information.
was
And
so fun. Thank you for having me.
yeah,